Good morning, everyone, and assalamu alaikum to all our online followers. We're here today in the dedicated breastfeeding space at the UN House in Dushanbe, and we have the privilege to have a conversation with Masumi. Masumi, why don't you go ahead and introduce yourself?
Hi, good morning. My name is Masumi. I work at UNICEF Tajikistan as a nutrition specialist, and my work is all about trying to improve nutrition for children, pregnant, and breastfeeding mothers.
Wonderful. Thank you so much, Masumi, for taking the time out to have a discussion with us today. So August is breastfeeding month, and it's really important for us to talk a lot about breastfeeding and for us to talk more about breastfeeding. What are some of the key messages that you'd like to give to mums and also their partners about the importance and the impact of breastfeeding on children?
Breastfeeding has lots of health and emotional benefits. Breast milk contains all the nutrition that the baby needs for the first 6 months of life. It also protects them from infections and saves lives. And there are also benefits for mothers, like helping their recovery after delivery and protecting them from future diseases like ovarian and breast cancers. It also helps to build bonds between the mother and the baby, so it's very beautiful. So if you decide that you want to breastfeed, then try to ask for help and try to build a support network around you. Your family can support you with the household chores and childcare for your older children. Your health workers can also ensure skin-to-skin contact and teach you how to breastfeed. And also you can ask your employer to consider flexible working arrangements once you're back at work. This year's theme for the breastfeeding week is prioritize breastfeeding, create a sustainable support system. This basically means that mothers get the help they need when they need it and wherever they are, whether they're at work, at home, or at health facilities.
Great. And I think you mentioned that, you had some experiences to share with us and everyone online about how you navigated the challenges between breastfeeding and being a very busy working full-time mom. And of course, you have 2 young children. And maybe you'd like to share some experiences with everyone online about how you navigated that balance.
Yes, I have been advocating for breastfeeding since I started my career, but it was only when I had my own child that I realized how difficult it was to breastfeed. And I did breastfeed both of my children, but I could not have done it without the support from all around me. My family was very supportive of my decision to breastfeed my children, so they let me focus on breastfeeding and rest after delivery. My midwives and lactation consultants were there day and night to help me establish breastfeeding, but also for many weeks after discharge. And once and UNICEF, where I work, offered me 24 weeks of paid maternity leave. So that helped me, recover and create bonds with my children. But also once I was back at work, I took advantage of different flexible working arrangements, such as breastfeeding breaks twice during the office hours, as well as working from home. Actually, right now, we are in a breastfeeding room in the office, where I used to breastfeed my child every day. But one day I was in a meeting and my baby was too hungry to wait for me to come out of the meeting. So I ended up breastfeeding in the meeting while my colleagues were discussing serious stuff. So I'm very grateful that my colleagues in UNICEF were very understanding and accommodative as well.
Sumi, thank you for sharing that experience with everybody. So it's really important for employers to be flexible when it comes to staff and employees who are breastfeeding. How important do you think a dedicated breastfeeding room is? And would you encourage other employers in Tajikistan to have such a space?
Yes, I think knowing that there was a breastfeeding room in the office really made it easier for me to come back and not worry about dropping my milk supply, or sacrificing my bond with my child. And it's in the office, and so it really helps to manage time within your busy schedule at work. And I think all employers should consider the unique needs of the breastfeeding mothers by creating a dedicated space, very private and safe space for breastfeeding mothers to use, but also implementing other measures like flexible working hours and working arrangements. Finally, I want to note that breastfeeding is not easy. It takes determination, and it also takes a village. And I really hope that all the mothers who want to breastfeed will get the support they need so they can enjoy this special moment with their baby.
Masumi, thank you so much. And tashakkur to everyone online. I think we've learned a lot. And also, if anyone wants to reach out for more information, what would you suggest that they do?
They can reach out to UNICEF's websites, UNICEF's social media, and the Ministry of Health and Social Protection also has lots of information. And of course, if you are about to start breastfeeding or you're already breastfeeding, you can also reach out to your health providers.
Thank you so much for sharing everything with us today, Masumi. We really appreciate it. Thank you for your time.